पॉलिसी बाजार पर 1 करोड़ रुपए का टर्म लाइफ इंश्योरेंस केवल 450 रुपए महीने से शुरू। Wow.
China, amid its surge as far as COVID cases are concerned, has decided to ease COVID curbs. China on Monday said that it would scrap the mandatory quarantine on arrival and further unwinding years of strict virus controls as the country battles a surge in cases. Having mostly cut itself off from the rest of the world during the pandemic, China is now experiencing an unprecedented surge in infections after abruptly lifting restrictions that torpedoed the economy and sparked nationwide protests.
Right, so multiple reports now suggesting that China is now lifting those COVID norms even though cases are still really high. Now, to get more details on this and understand what are these curbs that are being lifted, we're joined by a Chinese reporter from CGTN, Yunfei. Thanks very much for joining us. If you could first take us through the curbs that the Chinese government is lifting now despite a rapid surge of COVID-19 cases.
Well, it's an entire process. Thank you for having me again. I can still remember the first time I was on NDTV was really 3 years ago when I was reporting in Wuhan. The city first reported the cases, and back then the situation was very severe. And when we come to this point, with the mutation has been rapidly changing from the Alpha all the way to Omicron, the evaluation by the Chinese health officials saying that the Omicron variant is no longer threatening and it won't cause a deadly impact on the people. So that's why the country is swifting its policy on the COVID-19 control and prevention.
Right. If you can take us through the situation at hand as to the numbers, that are being reported daily, the kind of deaths that are being reported. Also, they have started to now lift the curbs. So take us through those curbs, those restrictions that were in place for 3 years are now being lifted, including no longer the passengers coming into China will have to quarantine as far as the COVID situation is concerned.
I wouldn't say that it's lifting something. It's not a process of lifting the restriction. I would say that this is adjustment of the policies, because previously, including the massive lockdown of the city, including the quarantine measures conducted by the health officials, all the measures are there to contain the spread, to curb the spread of the virus. And back then, when we talk about the Alpha variant, the Delta variant, both of the variants are very deadly virus back then. So if we let it go, and it will cause huge damage to the society. And now when it comes to Omicron variant, the evaluations is that it's no longer pneumonia anymore. The death rate has been lowered, and that's why it's been adjusting the measures. And it's still an epidemic. I mean, people are still evaluating this is something that caused infection. So China is still taking measures to make sure that to protect the health and safety of the people.
Right. Of course, as you mentioned that China is taking measures just to adjust to the COVID cases, but not entirely lifting these norms. So are you saying that the zero COVID policy, of course, was not in place as those measures were lifted? So what are the relaxations? Are there any relaxations, or does the condition stand the same as you're saying that they're just adjusting and not really lifting any norms?
I would say that back then, the zero COVID policy you mentioned about is actually the dynamic zero COVID policy. And all the reason behind that is that the health officials is trying to curb the number of cases. So they call it dynamic zero COVID policy. It's not an absolute zero COVID policy. So it's a narrative thing. And on the other hand, you're talking about the relaxation of the policy. There are many perspectives. People entering places, let's say shopping malls and airports and many public areas. They no longer need to scan code to track their health situation. And there's a more convenient for people to travel throughout the country, as well as we're expecting the early January, people will be able to have more flexibility in travel internationally.
Right, and we were also seeing those reports of massive surge of cases and deaths in China, but the official figures definitely were not reflecting the same. If you could take us through the actual number of infections that you're picking up from China, how rampant is the surge at a time when these curbs are reportedly being lifted?
Well, it's the adjustment of the policy. It's really not easy to keep track of the really this exact number of infections because there are so many people got infected and they stayed at home. So it's not possible for them to, let's say, report their health conditions to the officials. So it's not easy for the officials to get the exact number of the infection cases. That's why the local health authorities no longer release the official data because the number would not present the accurate people who got infected. There are certain a level degree of infections across the nation. There are many friends around us get infected. But remember, this is something that happened to all around the world. If you see the countries that relaxed their policies earlier in the years, let's say earlier in 2020 or 2021, the death rate will be much higher because remember, those variants are way more threatening.
Well, according to prediction, the outbreak is expected to reach its peak in the month of January, given that, it took a lot of protests in China for those for that zero policy to be lifted and, these easing of the norms to come about. We now also hearing that there will be no demarcation as far as high-risk areas are concerned in China.
Absolutely. So, again, because people are adjusting their views on these kind of the virus. The official health officials have been downgrading the category of the virus and downgrading the potential threatness of the virus. That's why there's not a reason for the local authorities to identify this is the high risk area and that is the low risk area because they don't want to give the local health officials an excuse to lock down the city or lock down the neighborhoods, and that will brought inconvenience to the local people. That's why they ignore the policy of marking the place of high risk area or the low risk area. The overall idea for that is to bring more convenience for the people, so that people can hop onto a new level of health working and living experience in the post-pandemic era.
Right. And Yunfei, if we can also get an idea of how China is coping with it. We saw reports of the health infrastructure being overburdened, 30 days of waiting at crematoria. Does the situation still stand, or what are you picking up on how the health infrastructure is being able to deal with this COVID surge?
Well, China has always been adjusting the health policies, as well as China has been handing out the handbooks and guidelines for epidemic prevention and control. It has been revising into 9 editions based on the change of the strain of the virus. And also talking about the infrastructure of health. I mean, over the past 3 years, China has been really boosting the ICU capacity, including the number of beds as well as ICU doctors. So the capacity of medicine, the capacity and testing speed of the PCR test and antigen test has always been boosting. So it really, over the past years, I would say that the country really learned from the epidemic and increased its reserves in health sectors.